Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello, and welcome to episode 32 of podcast. I'm Dr. Teri Fisher, and as always, it is great to have you along. Today's podcast episode is all about TMJ, or temporomandibular joint pain, or dysfunction as it is sometimes called, and how we can use neuromodulators, those drugs such as Botox, Dysport, Xeomin, Nuceiva, to help treat this TMJ pain, which can, for so many people, be a real source of chronic issues for them. As you may know, I have a number of pillars that guide my treatments, and some of these include safety, expertise, enjoyable experiences, customized treatments, and I believe that this topic aligns really nicely with these principles, and I want to talk a little bit about that today, and what exactly does it mean to have a neuromodulator treatment for TMJ pain. So let's get some really basic definitions out of the way right off the bat here. I'm going to be referring to temporomandibular joint pain a lot in this podcast episode as TMJ pain, simply because it's easier to say and it's shorter. But just know that that is what I mean when I say TMJ pain. It is sometimes referred to as TMJ disorders or TMJ syndrome. There's a lot of different names for this because it is quite a multifaceted condition. It is extremely common. It's been estimated that the prevalence can be as high as 31% in adults and even 11% in children. And it is associated with decreased quality of life, decreased work productivity, and overall a substantial morbidity with the people that do have this condition. So it is really, really important. We typically see about 1.5 times higher rates in females compared to males. And the greatest risk of onset of TMJ disorders is between the ages of 18 and 44. So what exactly is it? Well, the TMJ, or the temporomandibular joint, is the joint that is between your jaw, the mandible, and the glenoid fossa, which is part of your skull where the jaw goes into the skull and creates the joint so that you're able to open and close your jaw when you are speaking, when you are eating. And so it is a very busy joint. It is opening and closing many, many hundreds of times a day. And sometimes this can get painful. The TMJ is controlled by a number of key muscles. There are some other smaller muscles, but the two main ones are the masseter and the temporalis. If you reach out and touch the lower part of your jaw on either side and bite together, you will feel something that kind of swells out underneath your fingers. That is your masseter, and it's an extremely strong muscle in your face and in your head. The temporalis muscle is a little bit higher up. So if you go up higher, just to approximately the hairline, the temples almost, then you will find, if you clench your jaw, you will feel, again, a little bit of a muscle bulging, and that is where you can feel the temporalis muscle. And those two muscles are the muscles that are used to control your jaw functioning. Now, a lot of people do have chronic pain in this area. Sometimes it can be due to some injury to the jaw. Sometimes it can be due to posture. Sometimes it can be due to headaches. There are lots and lots of reasons that people can have TMJ pain. The most common signs and symptoms of TMJ pain are, well, the first one's obvious, pain. You can also have some ear discomfort in the region. You can have headaches, and you can actually have some dysfunction of the jaw where the jaw doesn't feel like it is moving properly. Now, let's get into the topic today, and that is neuromodulators. So again, if you haven't heard some of my previous episodes, neuromodulators are the type of drugs that relax muscles. They work by interrupting the signal from the nerves to the muscle to contract. And when you interrupt that signal that's telling a muscle to contract, well, it can't. And so it has to relax. And so that is where Botox, Nuceiva, Dysport, and Xeomin come in. Those four are the four main brand names of neuromodulators, and they all work in similar ways. these can be injected strategically into those two main muscles that I've been speaking about, into the masseter and into the temporalis. And when we do that, it allows those muscles to relax. When they relax, they obviously can't contract as strongly, and that means that there is less force going through the jaw with each bite. Now, this has to be done in a personalized approach, and again, as I mentioned, that's one of my pillars. It's very important that we assess the jaw so that we know the appropriate dose, because theoretically, if we injected too much, you could actually find it harder to chew your food because your jaw wouldn't be strong enough. We attempt to find the ideal dose that allows the jaw to relax to the point that it takes some of that pain away, but of course, not so much to the point that it makes it difficult to chew food or to move the jaw. How does the treatment actually happen? It's quite simple. We have you come into the clinic, we do our assessment, we ask you a bunch of questions. When we get to actually doing the treatment, we simply drop a little bit of the chosen neuromodulator and we inject in a couple of different points along the masseter muscle, lower down in the face, and sometimes, not always, but sometimes into the temporalis muscle as well, higher up along either side of the face. There are, of course, other treatments that can be done for TMJ pain. One of the things is using a night guard if you grind your teeth. As well, sometimes some anti-inflammatories can be used for the pain, and there are other things that can be done as well, but it's very important to have a thorough medical assessment by a professional to figure out what would be the best approach for you. I want to reassure you that TMJ pain treated by neuromodulators is backed by medical research. It's been proven to be safe and effective. And while the treatment can provide significant relief, it is also important to remember that the results are temporary, because once the neuromodulator wears out, then it has to be done again. So that could be a number of months down the road. If neuromodulator treatments, these injections that I've been speaking about, sound appealing to you for your TMJ pain, or if you know somebody who is suffering from a TMJ disorder and they would like to look at getting neuromodulator treatments for this, then of course I'm delighted to be able to chat with you or that person about this. Please feel free to contact us at antiagingvancouver.com. You can also contact me through my personal website at drterifisher.com, or you can also contact me through Instagram at drterifisher. I want to thank you again for joining me on this episode of Anti-Aging Insights. We've explored the realm of neuromodulators for TMJ pain relief and highlighting how this innovative approach aligns with my pillars of treatments: safety, customized treatments, expertise, and enjoyable experiences. So, again, as I said, if you're interested in finding out more, please feel free to contact me, and I look forward to chatting with you again very soon. Till next time, be well.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.